Okay, so first up, tell us what norovirus is and what symptoms people need to look out for.
Sure. So, norovirus is a very common virus we see mainly this time of year, but we do see it throughout the year. It's a virus that causes inflammation of the lining of the stomach and the intestines. So, a very common cause of vomiting and diarrheal illnesses this time of year.
And why is it surging right now, this time of year, you said?
So we know that over the last decade or so, that this virus tends to mutate every few years. And when it mutates, people don't typically have immunity to the strain of virus that's circulating. And so we do see increased number of cases every few years that coincides with the mutations of the virus. We also know that testing has become more widely available. So emergency rooms and even many doctors' offices now have the ability to test for this virus. So we're seeing it more often just because more people are aware of it.
So who's most at risk for getting norovirus and how can those people protect themselves?
Sure. So this is really important. We know that the extremes of age are the ones that are most typically affected. So the youngest children, those being under 5 years of age, and seniors over 65, typically have the most severe disease. Children under 5 years of age also are more likely to have exposure to the virus. They're not cleaning their hands as well, touching surfaces that may be contaminated. So it's really important that we're aware, when children do get ill, that we try to keep them out of especially daycare and school settings.
Yes, I have a 3-year-old and we've already had norovirus this year. So the question is, a lot of people I see like on social media asking when they get it, like fellow parents out there, how long does it typically last?
Right. So the good news is that most people don't have severe disease, and the symptoms are usually present for maybe about 24 to 48 hours. But some people do remain sick for a little bit longer and can have some feelings of illness beyond the 48-hour mark as well. I think it's important to note that even though some people may not show severe symptoms of the disease, they can still be contagious and can infect others. And that even after the symptoms have passed, within the next few days, they could also still remain contagious and be infectious.
Yeah, so definitely be careful, wash your hands, wash everything around you, and just be mindful. All right, well, thank you, Dr. Shapiro, for joining us this morning.
Great, thanks for having me.
All right.